Good afternoon, everyone. Thank you for joining us today. This is the general information session where we will be going over all of the graduate programs that are offered at the UB School of Nursing. Please note that this session is being recorded, so please, for those that are attending live, keep yourself muted throughout the presentation. There will be time at the end where we will stop the recording and take any questions that you have during the time. With that, let's get started. So first, a little bit about the University at Buffalo. We are the SUNY flagship university. We are both the largest and most comprehensive university within the SUNY system. We are a member of the Association of American Universities, which puts us in the top rankings of the universities around the country with an emphasis on research and academic excellence. While the University of Buffalo is the largest school in both the SUNY system and in New York State, the School of Nursing is the smallest school or unit within the UB system. All of our programs offer a robust education that will prepare you to become a nursing scientist or a nurse leader. We emphasize community partnerships and global health by providing hands-on training for our students to become nursing leaders. All of our programs are fully accredited, both the DNP and PhD programs, that will ensure a supportive and research-intense environment where you'll be able to make a significant impact on healthcare once you graduate from our program. While I said the UB is extremely large, the School of Nursing is small, with only about 250 graduates enrolled at one time. Let's go into a comparison of the two different degrees that we offer. We currently offer two different degree tracks at the University of Buffalo School of Nursing. The first, a Doctor of Philosophy in Nursing, or PhD program. The main goal here is for you to become a nursing researcher. The end goal is that you will work in an academic or research setting where you will contribute to the field of nursing. The program here will end in a dissertation. It is important to note that our program is a nursing research PhD program, not a nursing education program. That does not mean that you will not go on to teach as part of your future job. However, it just means that the focus of your actual education will be clinical research rather than nursing education. The DNP program, on the other hand, or Doctor of Nursing Practice, is for you to become a doctorally prepared nurse practitioner. This is more focused on clinical practice than research. However, you will be using research both in your education and in your career to improve patient outcomes. The program here will end in a capstone project. This is much smaller in scope than that of a dissertation for the PhD track. It is something that you will be able to answer in 2 semesters and 2 semesters only. Each of the degrees have a few different entry points that students can come in as. The PhD program offers a post-bachelor's, a post-master's, and a post-DNP entry point. We are one of the few schools around the country that is offering a post-DNP entry point. The DNP program offers 4 direct entry specialties and 6 post-master's completion specialties. Let's now go into a bit of the program overviews to give you more details on each of the program. Starting with a PhD in nursing, again, our graduates are equipped to advance nursing practice in healthcare through research and theory development. Our students are trained to communicate effectively across disciplines, enabling them to lead interdisciplinary teaching and research efforts. Due to the wide scope of research interests at the University at Buffalo, our students will have access to not just the nursing researchers, but the School of Public Health, Jacobs School of Medicine and Biomedical Sciences, School of Social Work, School of Dental Medicine. There's a wide area of students that support areas that students will be able to help with their own research. Our program is taught in a synchronous distance format that allows students flexibility while completing their degree. The synchronous classes are taught on Mondays or Tuesdays during the fall and spring semesters. For the PhD program, there are no winter or summer classes that you will need to take. And when it comes time to planning ahead on how much you will be in class, a good rule of thumb that we allow our students is that each semester you will be in class for about half of one of those days. So about half of Monday or half of Tuesday. Rarely will you have classes on both. You will know your schedule well in advance, so students can adjust their work schedule accordingly. One of the most challenging parts about a PhD program is finding faculty researchers that have similar areas of interest because research is big, there's lots of different topics, and no one school has faculty doing research on every single topic. So when finding a PhD program that's right for you, you want to be aware of that and take a look at what faculty are researching. The 6 general areas that most of our faculty are working on are behavioral health, sleep, oncology, reproductive sexual health, environmental impacts on health, and nursing simulation. By no means is that a complete and exhaustive list, but it is just a sampling of the major points that our faculty researchers are doing. As I mentioned before, we have 3 different entry points for students. Which basically means the highest level of degree that you've had prior to joining our PhD program. And really the difference there is the number of credits needed to complete and the average time to completion. The post-bachelor's entry point requires 79 credits with an average time to completion of 5 to 6 years. The postmaster's entry point requires 57 credits needed with an average time to completion of 4 to 5 years. And the post-DNP entry point requires 36 credits needed to complete your PhD with an average time to completion of 3 to 4 years. As you'll know, all 3 entry points have average time to completion. That's because the PhD program offers you a lot of flexibility when it comes to how many courses you are taking a semester. Last year, we had 2 students that graduated. Both entered at the postmaster's entry point. One graduated 4 years on the dot. They came in very determined. They took a very aggressive course load and were able to graduate right on time. Their time, I should say. The other came in at the postmaster's entry point, but they completed the program in 6 years. They didn't do anything wrong. They didn't fail any courses. They didn't need to redo any of their research, but they had a lot of outside obligations and chose to take the course at a much slower pace, which is completely fine. As long as you are communicating with your associate dean and faculty members, we are very accommodating for the PhD program on how many courses you're taking. And regardless of the entry point that you have, the PhD program will always start in the fall semester. There is no spring or summer start for this program. Moving on to our Doctor of Nursing Practice. The Doctor of Nursing Practice is the degree that will allow you to become a nurse practitioner. We made the switch to a DNP program versus a master's program in 2011. So we have been doing this well over a decade. The reason that we made that switch is there's a few. One, the degree as a doctoral degree more closely aligns with the research goals of the university and the School of Nursing by having you gain your doctorate. Additionally, in New York State, which is the state that we are located in, if an individual has their Doctor of Nursing Practice versus their Master's of Nursing Science, they do have a wider scope of practice, allowing you to practice more independently or on your own than a master's degree would not allow you to do. As I mentioned before, we have 4 different entry levels, which is specialty entries, which means this is the program that you would do. And then when you graduate the program, this is the type of nurse practitioner that you would allow to take the boards for. First, our Adult Gerontology Primary Care Program, or AGMP program, assesses and diagnoses and manages all adults across a variety of different spectrums. While each state licensing rules will vary slightly, AGMPs in New York can work with individuals 14 years or up. I know that a number of people, when they see adult gerontology, assume that they will be working in nursing homes for their career, which is certainly a career path that many of our graduates take. However, in New York State, you are eligible to work with individuals 14 years or up, meaning that your scope of practice is much wider than some people traditionally believe. Our program is focused on primary care, which emphasizes the patient's ongoing health needs and wellness. However, our program does offer some acute care due to the nature of this specialty. This does not mean that you would be eligible to become an acute care nurse practitioner. However, you do have it during your training. Students will need to complete up to 1,000 clinical hours at an approved site that we will assign. The program is 84 credits in length, and you can start in the summer if you are planning to go at a full-time pace, or fall if you are planning to go at a part-time pace. Students will complete this program on an average of 4 years. The majority of students in the AGMP program, as most of our MP programs, will take the program at a part-time pace. They have some flexibility with how many courses they are taking each semester. However, it's not as flexible as the PhD program, but there is still some flexibility. Sometimes students will start full-time and they will drop down to a part-time pace, which is fine. Or maybe students will, for one semester, will ramp up a little bit because they have something personal the next semester and they don't want to get too out of sync. Okay. On average of 4 years, that's how long students are typically taking to do this program. The next specialty is the Family Nurse Practitioner program. Again, like the AGMP program, this program is primary care focused with not much acute care focus. Students here, though, will be eligible to work with patients across the lifespan, meaning that from the minute they're born to the minute they die, they're eligible to work with them. As an FNP, you will emphasize compassionate inquiry-based nursing for underserved populations and integrate clinical leadership in enhancing primary care access. All of our programs have a big community aspect. However, our FNP builds it in the most, working with a number of different clinics around the Buffalo area that will focus on underserved populations. Students here, again, will complete up to 1,000 clinical hours at an approved site that we will assign in the Western New York area. The program is 97 credits in length, and again, just like the AJMP program, you can start in the summer semester for a full-time course or fall semester for a part-time course with an average time of completion of 4 years. Our next specialty is our nurse anesthetist specialty, or CRNA program. This program is highly, highly competitive, and while it is a DNP program, just like the previous two specialties, the format, both admissions requirements wise, as well as the format that you would actually be in the program, are very different than the primary care specialties. Our program, in addition to providing you the clinical knowledge to be a successful nurse practitioner, will give you access to research and leadership classes that a number of programs throughout the country don't necessarily provide. Our students will work very closely with our program director to start networking with other CRNAs around the country very early in their career. So by the time they graduate, they will have built up a network that is very valuable to them. The state-of-the-art facilities that we have on South Campus, which is where the School of Nursing is located, will enhance your didactic and clinical courses by giving you hands-on education prior to you actually starting clinical. Students will complete 2,200 clinical hours at a site we will assign. 2,200 hours are obviously more than double the previous specialties. However, these sites are sites that we will assign, and you will not need to fight for OR time. While there may be students from other programs at your site, either from another CRNA program, or maybe even an MD student doing their anesthesia rotation, you will not need to compete for your attention. You will get your hours that you will need. The program is 124 credits in length. While this is the longest in terms of credits, this is only a summer start program and you can only go at a full-time pace. So while the program is the longest in terms of credits in clinical, it is traditionally the shortest program in terms of time that you will actually be at the University of Buffalo. You will complete this program in 3 years after starting. You will start this program in summer, which summer semester starts in May. You will do summer, fall, spring, times 3. So you will graduate May 3 years after you have started the program. Our fourth and final NP specialty that you can do is the Psychiatric Mental Health Nurse Practitioner program. This program provides graduates the education to provide primary mental health care across the lifespan. In addition to traditional therapy that students can provide, our program does allow students to diagnose and prescribe various therapeutic interventions that are certified by New York State for practice that include the prescription of psychotropic and other medication used in mental health and addiction treatment. Students will complete up to 1,000 clinical hours at a site that we will assign. The program is 94 credits in length, and students can start in the summer for a full-time pace or fall for a part-time pace, with again, an average time to completion of 4 years. One of the most important things about doing a program like this is, one, ensuring that you will be supported academically, but two, you will be given the tools to succeed once you graduate. One of the biggest benchmarkers of that is the board pass rates for our nurse practitioner programs. 2024 was the last available year that we have data for the entire class, which is the year that we're using now. For the primary care programs, that's the adult gerontology nurse practitioner, family nurse practitioner, and psychiatric mental health program, we had 100% first-time pass rate across the board, well above the national average of 85 for AGMP and 83% for FNP and psych mental health. The FNP program particularly has had a 100% pass rate for the past 10 years. The CRNA program, that also has their own boards, had a 95% first-time pass rate in 2024, still well above the national average of 83.2% for 2024. We also have a postmaster's DNP completion program. This program is designed to provide practicing nurse practitioners with the doctoral courses they did not take in their MSN program. This program will allow students to obtain their DNP in their existing specialty. This is not a program for you to gain a new specialty. This program is providing you with the doctoral courses you did not have in your master's program. If you have your master's degree and would like to gain a new specialty, or potentially you have your master's in nursing leadership, you can apply into our traditional DNP program, and we would award transfer credit where transfer credit is due. There are no clinical hours that students will need to complete for the postmaster's DNP completion program. That is because you are already a licensed nurse practitioner, meaning that you have already verified that you have the skills to provide a health assessment. However, you will have 400 non-clinical hours that you will need to complete. These non-clinical hours, I should say, are hours that will be used while you are working on your DNP project, traditionally done at the student's place of employment. The program is 36 credits in length, and you can start this program in the spring or fall semesters. This program will be taken at a part-time pace and is completely taught asynchronously online. You will complete this program on an average of 2 to 3 years. There are no on-campus requirements for this program. Traditionally, the first time that we meet these students is when they are walking across the stage at graduation. While this is a completion program, you do need to be licensed in one of the 6 specialties that's listed on the screen. If you have a specialty outside of this area, please reach out to nursing@buffalo.edu to see if we can support you on your goal of becoming a DNP. Pardon me. Finally, I would like to talk about our early assurance doctoral program. Our early assurance option was for students that are currently enrolled in their undergraduate education and would like to dive right into a doctoral program. Not every program has an early assurance options. We offer early assurance options for the following programs: the adult gerontology primary care, family nurse practitioner, PhD, and psychiatric mental health nurse practitioner. Please note there is no early assurance option for the CRNA program. Students that are accepted into this program would progress at a part-time pace while gaining experience working as a nurse. You will need a higher GPA to be accepted into the program, but you do not need to be a nurse to be accepted into the program. I will go over the admission requirements, including the GPA requirements, in a future slide. Before we get to the admissions side, I just would like to talk about a few nursing features that highlight our school. First are our global health experiences. We understand that due to the demands of nursing education, both at the undergraduate and graduate level, many students don't have the time to take a study abroad opportunity. Our global health experiences allow students to take short-term mini study abroad experiences around the globe so that they can practice their clinical skills in an area that they might not be exposed to. So places that we have sent students to so far include Haiti, Belize, Ghana, Peru, Greece, Senegal, and the rural Appalachian areas. This is not a final list. We are always exploring new opportunities to send our students out to practice their skills. The photos there are, in the top photo is a CRNA and an FNP student working at a clinic in Ghana. The bottom left-hand photo is a group of undergraduate, graduate, and dental students that are working at a clinic in Belize. And the bottom right-hand photo is a combination of undergraduate, graduate, and faculty members that are working at a vaccine pop-up clinic in the rural Appalachian areas of West Virginia. All of our global health experiences take place during student breaks, so they are eligible to all specialties, including the CRNA program. Additionally, we have invested a lot of time and money into building up our simulation center so that all students can experience it to enhance their skills. All of our programs have provided a robust, high-quality simulations. Our operating room and health assessment labs allow graduate students to practice their skills before and during their clinical rotations so that they can be the strongest that they can be. Recently, the School of Nursing was just awarded a $34 million grant to create SUNY's first Nursing Simulation Center of Excellence. This was the largest award in the school's history. All of our programs, like I said, have some access to simulation. The top right photo is students working with our program director, Dr. Cheryl Spilecki, in the CRNA operating lab. The bottom left-hand photo is a FNP student that is giving a health assessment to an actor to practice their skills. And the bottom right-hand photo is an undergraduate student that is using virtual reality to simulate different experiences beyond the clinical setting that they will be exposed to in the hospital setting. These could include things like disruptive caregivers of patients, different simulations that students can use to better enhance their skills. And obviously support for your education. You want to be able to go to a graduate school that will provide you different support for your education. We offer the Abbott Library, which is the photo there. That is a short 3-minute walk from the School of Nursing. That is our health science library on campus. That is there to support not just the School of Nursing, but any health science related student at the school. The UB Office of Fellowship and Scholarship is specifically designed to help students fund their education. This could be a 1-semester scholarship or a full tuition or a full ride throughout your entirety of the program. The Career Design Center can help with resume and interview prep so that you can go on and find your dream career once you graduate. The Center for Excellence in Writing is vital to our students. While most students during their career as a nurse do not have to write a lot of papers, writing in a doctoral program is vital. So having that support for our students that maybe don't traditionally write a lot of research papers is very, very important. In short, we have the resources of the largest university in New York State in a small atmosphere that supports our students. Let's now go on to our admission requirements. First, the requirements for all of the program. All of our programs require a Bachelor's of Science in Nursing from an accredited institution. You must have your active US RN license. If you are applying to the PhD program, we will accept your foreign license at the time of application. However, please note that you likely will need to get your state license if you plan to do research in the States. We require 3 letters of recommendation and only 3 letters of recommendation. Those should be written by a graduate educated professional, so someone with a graduate degree, or a healthcare worker that you have worked with within the past 5 years. If you are applying to the PhD program, we do request that one of those letters come from an individual with a doctorate degree. We require a personal statement. We're not looking for the next great American novel. We're just asking you to answer 4 or 5 questions in essay format that are provided to you on the portal. We require a current resume or CV and transcripts from every school that you've attended at the collegiate level. To talk a little bit more about the transcripts that we require, the university requires that we must have transcripts from every school that you've attended during your collegiate education, meaning that if you only ever went to one school and you have no transfer credit from anywhere, you only need to provide 1 transcript. However, if you have transfer credit from 4 different schools and then you have a degree from another school, you'll need to provide transcripts for every single one of those schools. When it comes to unofficial versus unofficial transcripts, we request that official transcripts be submitted, but from any institution that is awarding you a Bachelor's of Science in Nursing, any graduate degree, and any international institution. We will take unofficial transcripts from all other schools. However, unofficial transcripts still must be clear and legible for us to use them. Please, before you upload any unofficial transcripts, be sure that the unofficial transcripts are clear and concise. They must have your name on them, the institution's name on them. If you have a degree from that institution, it needs to be listed, and it must have grades and a GPA for us to use them. Screenshots of transcripts unfortunately cannot be accepted as they do not communicate well with our application system and get very disjointed. GPA minimums. If you are an early assurance student, you will need to meet a 3.5 nursing GPA and a 3.0 overall GPA. I will talk about the difference between a nursing GPA and an overall GPA on the next slide. If you are applying to the AJMP, FNP, Psych Mental Health, DMP programs, you need to have a 3.0 nursing GPA and a 3.0 overall GPA. If you are applying to the CRNA program, you do need to have a 3.25 nursing GPA and a 3.0 overall GPA. Students applying to the Postmaster's DMP program need a 3.25 from where they obtain their MSN. And for PhD students, you do need a 3.25 overall GPA. The difference between a nursing and an overall GPA. An overall GPA is a combination of all of your credits and quality points averaged between all of your schools that you've attended within the past 10 years, with the exception of any nursing degree, which never expire. For example, if you graduated in 2000 from a school with an engineering degree, and then graduated from another school in 2005 with a nursing degree, both of those are outside the 10-year time frame. However, the nursing degree never expires, so the nursing degree is what we will use to calculate your overall GPA. Vice versa, if you graduated in 2020 with an English degree and then graduated in 2021 with a nursing degree, both of those degrees are within the 10-year time frame, so they will both be used to calculate your overall GPA. Your nursing GPA, on the other hand, are all of your nursing specific courses. So anything with your school's code, it's traditionally very easy to figure out. The common ones are NU and NURS, plus some liberal arts courses that most nurses have completed. Examples of this are A&P 1 and 2, microbiology, and chemistry. Well, we have a list of liberal arts courses that we will look at to create your nursing GPA. None of our programs, including the CRNA program, have any pre-required coursework. The reason for that is that we see no benefit of requiring a practicing nurse practitioner that graduated from an accredited school go back and retake an undergraduate course that they did not have to take during their program. The best two examples of this are sociology and pharmacology. Almost all nursing programs around the country will require students to take a Sociology 101 course. However, some do not. I do not think that you'd be able to find any nurse practitioner or PhD in nursing that would say that you cannot be a nursing scientist or nurse practitioner without a Sociology 101 course. The other example is pharmacology. In order to have graduated from a BSN in the United States, you need to have taken pharmacology. However, a lot of nursing programs will build the pharmacology content into courses that are called Nursing 1 and Nursing 2. So while you may have not had a standalone course, we know that you have had the content. So we see no benefit of making you go back and retaking any course. Program-specific requirements. If you are applying to the AGMP, FNP, or Psych Mental Health Nurse Practitioner program, you do need to have 1 year of RN work experience. If you are applying directly into the CRNA program, you must have 1 year of ICU experience. It must be in an ICU, that it is an accreditation requirement that we will not bend on, and it does not include any orientation period that your ICU may have, and that is due at the time of application, not the time you would start the program. The Postmaster's DMP program requires you to have your national certification and your license for your existing specialty. And the PhD program do request that you submit some scholarly writing samples. If you're applying into the postbachelor's or postmaster's level, you need to submit 2 writing samples. And if you're an early assurance or post-DMP applicant, you only need to submit 1. None of our programs require the GRE or MAT. Submitting a score will not improve your application, and it will not be used to review you for your program. The application open and close dates. If you are looking to apply for the PhD program for a fall 2026 start, the application opened today. So we are currently accepting applications for this program. those applications are due March 15th. If you are applying to the AGMP program, FNP program, or Psych for 2026, that application will open on October 1st. Summer applications are due on April 1st, and fall applications are due on June 15th. If you are applying for the CRNA program, we just closed our CRNA cycle. We will not be accepting any more applications for the summer 2026 start. We will again be accepting applications for the summer 2027 start in mid-July of 2026. If you are looking to apply for the postmaster's program for the spring of 2026, those applications are also being accepted, with all of them being due on January 4th. All applications are needed to be complete by your deadline, meaning that all application materials, including the letters of recommendation, must be received by the deadline. With that, for those that are watching in the future, if you have any questions about our programs, please feel free to email nursing@buffalo.edu, and we'd be happy to answer your questions. Thank you and have a good day.